My name is Haley. I'm going to be your nurse today, and today we're going to be performing a procedure called inserting a Foley catheter. Before we begin, I'm going to go wash my hands and close the door for patient privacy, and then we'll get started. Okay, I'm back. So, now I'm going to put on my clean gloves and explain the procedure. So, today I'm going to be taking a long, thin plastic tube and inserting it into your urinary meatus, which is an opening above your vaginal opening. That tube is going to go all the way into your bladder, where it will sit, and then your urine will drain from your bladder into the tube all the way down into a bag where your urine will collect. So now I'm going to help you into a comfortable position, and I'm going to have you spread your legs apart with your knees bent and your legs pointing outwards. And now we'll begin. So the first thing I'm going to do is cleanse the perineal area with no rinse water and soap. Now I'm going to dry that area. Okay, the next thing I'm going to do is examine the perineal area to find the urinary meatus. Okay. Urinary meatus is the top hole right here where my finger is, and it is above the vaginal opening, which is down here. Okay, now that I have identified the urinary meatus, I am going to remove my gloves and perform hand hygiene. Okay, now that I have performed hand hygiene, we can go ahead and get started. So I'm going to get my catheter kit. I'm going to open the outer wrapping of the catheter kit and place it as a bag by the patient's hip. I'm also going to make sure it's on a clean, dry surface. That can be a bedside table, or in this case, it is the patient's, between the patient's legs. And I am going to put the bed in a comfortable position for me to work at. Now I'm going to open this inner sterile wrapping covering the catheter kit using sterile technique. I'm going to fold back each flap of the wrapping one at a time with the last flap open toward the patient. Okay, now that that is done, I am going to apply sterile gloves correctly, maintaining sterility. So that means I'm going to take the thumb and the first two forefingers of my non-dominant hand and grasp the dominant glove and carefully put my hand in. Okay, now I'm going to do the same technique but with my gloved hand. I'm going to be careful not to touch the inside of this glove, and I'm going to stick my fingers into this one. Okay, the next step is to drape the patient underneath where their buttocks is, and then I'm going to drape the perineum. Okay, so I'm draping underneath the patient's buttocks, and then I'm taking this drape and putting it over their perineum area. Okay, now that that step is complete, I am going to arrange the remaining supplies on my kit, making sure that I am also maintaining sterility while doing that. Okay. So I'm going to get my alcohol swabs all ready to go. Okay, and I'm going to open the lubricant part of the package and put it into my kit so that my catheter tube will be ready to be all lubed up. Okay, and after that, I'm going to lube the catheter. Here is my catheter. Here is the tip, and I'm going to apply lube to it to make it easier on insertion. Okay, now I'm going to take my syringe, and I've taken the cap off, and I'm going to attach it to the balloon port with my non-dominant hand. Okay, now that that is done, I am almost ready. Whoops. I'm going to make sure I have all my supplies within reach. Okay, all right, so here's the fun part. So I am going to spread the patient's labia open with my non-dominant hand to visualize the meatus. Okay, now I have done that. I am going to use the dominant hand to cleanse the meatus with the alcohol swab. I'm going to use one cleansing swab for each swipe downward. So I'm going to get in between the labial folds. 1, 2, and the third one will be going down the center. 3. Okay. Next, I'm going to grasp the catheter firmly 2 to 3 inches from the lubricated tip with my dominant hand. My non-dominant hand hasn't moved. Okay, so I'm going to ask the patient to take a slow, deep breath in, and then when they exhale, I'm going to insert the catheter. Okay, ready? Go ahead and inhale, and exhale. Good. Okay, so while I'm inserting the catheter, I'm looking for urine flow. I'm going to advance it another 2 inches once I see urine flow. So 1, 2. Okay, now I'm holding the catheter with 2 fingers of my non-dominant hand to stabilize it at the meatus. Now I'm going to use my dominant hand to inflate the balloon with the pre-filled syringe. Okay, so now I am inflating the